You've just had an oral DNA test done and we've gotten the results. And the results always say use this antibiotic. Why aren't we prescribing an antibiotic? Now, that goes back to the reason you have periodontal disease in the first place. So let's talk about periodontal disease. Periodontal disease is the loss of bone support for the teeth, and it comes from primarily bacteria that goes below the gum line, lodges on the root surface with heavy accumulations of calcified bacteria. That's called calculus. And within the calculus, there are little openings where bacteria lodges. And so the source of the bacteria in your mouth very often is the calculus. Now, there's another source as well, and it's bacteria that lodges in the tissue. Our primary goal is to remove that calculus, and the bacteria within that calculus will go away. If we're able to do that, then we don't have to prescribe an antibiotic. Now, for some people who have very, very aggressive cases, we need to prescribe antibiotics. Our goal is not to prescribe antibiotics, however. It's clear that when we prescribe an antibiotic, it removes the balance of the bacteria, the viruses, and the fungi within the body. Some of you know what happens when you take antibiotics, yeast infections and that type of thing. What we're trying to do is to do as little as we need to in order to be able to control the infection. So when we do the oral DNA test, we want to know what it is that we're treating, and then we can treat it. Our choice as to whether we use an antibiotic or not depends upon the type of presentation you have, primarily the amount of calculus. And if you have a reasonable amount of calculus, we would prefer not to prescribe the antibiotic, then treat the calculus, you do all of your work at home, and then test you again later on. By our statistics, 50% of the people that we see will heal without antibiotics. And if you don't have antibiotics, your system doesn't have to recover from antibiotics.